So I want to pick up where I left off on the last video and discuss a little bit about the paradigm model of the current healthcare system, which is obviously broken, dysfunct, as I know from my own mother, my own relatives and stuff, to talk about a new model, a new way. As I told people, cardiac units in hospital aren't getting less full, it's actually getting more full. They're building bigger wings on cardiac hospitals and stuff. Number one cause of death in the United States is still heart disease. We've not changed that in the last 20 years. So we have to start thinking differently. We can't be using just the same models. Let's keep giving people more drugs. Let's keep lowering cholesterol numbers, even lower. 200 is not low enough. 150 is not low enough. Let's get to 100, and then we're going to start saving lives. And the answer is it keeps failing because it's not built on the right foundation. So I want to share with you what we found actually is to be a truth and a whole different way to look at this modeling and actually getting the best results. So our mentality and stuff is there's always a better way. I'm always looking for improvements and stuff, and I want to share with you what I found to be improvement for me and lots of my patients, that there is a better model than what we just currently described. That there's different ways to look at how we engage in with our health and how we actually engage and how improve our health. So the first way to do it, the first level, is actually about treatment of disease. This is all about, just having a health problem, and then we got to treat it. We got to wait till a problem develops and then we treat it with either drugs or surgeries. That's why we're spending lots of money on medications, all these fancy hospitals. I mean, this saves lives, but it usually doesn't improve health. So the level above that is all about prevention of disease. This is about preventing things from even happening. What can you do so you don't end up in? As we know, an ounce of prevention is worth a pound of cure or treatment disease. So if we're setting and doing things to prevent disease, we're not going to end up in trying to treat disease and spending a lot of money, a lot of time and focus and energy on that end of it. So that's what this is all about. But we don't hear anything about prevention. We hear a couple little things like, oh yeah, don't eat saturated fat, don't eat eggs, don't use salt, in which we all found all those things are actually false. Most doctors don't even know anything about preventing heart disease, even the top cardiologists. Actually, what's not interesting, and never thought I'd see the day, is I have patients coming in now telling me that their cardiologist told them that they need to eat more salt because it's robbing their body of that sodium potassium balance and causing a lot of heart arrhythmias. And it's like crazy now that we've actually just done another 360 on salt. Same thing with saturated fat, same thing with all those things and stuff. We found out that they don't understand prevention of disease, and we need to really understand that. And then the last level that we need to really talk about, which is what we do here in our office, is not about treating disease, not even about prevention, but about promoting health. What does that mean? It means doing everything you can to be as exceedingly healthy as possible. It's not about even prevention, but it's about getting to that last 100%. So your body is so healthy that it's not even going to have any breakdown. You're not even going to have a chink in your armor, so that you're not even going to set up your chance of actually having some of these diseases. And we want to teach you actually what that's all about. Because we know our wellness model of heart health really encompasses three things. One is overall health. It's not just looking at a specific one number and basing all of our recommendations off of a single number. And it has to be improving your overall health. You can't just take a medication for one number, but also suffer lifelong devastating side effects for the rest of your life just to trade off that you won't have one heart attack. That's not sufficient for me. That just doesn't fit in my model. It's also about lifestyle modifications. We're going to teach you, and already studies have shown 90% of a heart disease can be reversed if you do the right lifestyle modifications. And we're looking for long-term improvements. We just don't want to see temporarily certain numbers get better and then go right back down. We want to see them be long and sustaining, and we're going to teach you that also. As we already talked about, you're not destined by your genes to have certain health outcomes, that there is lots of ways to prevent heart disease. That the new model, and this is where a lot of things are coming down to, it's stress that's now related to heart disease. Not so much cholesterol, not so much all these other things, but they've now have seen stress. Stress causes, when you have inflammatory reaction inside your body, hormonal responses, causes plaque to build up. That's what's causing the plaque in your artery, stress, not cholesterol, not what you eat and stuff. Well, somewhat of what you eat. If you're eating garbage and stuff, it makes sense you will be developing that. But again, not eating fats is not going to cause decrease of cholesterol, because if you're still stressed out, your body's going to end up still making cholesterol. So you have to understand what's really causing it, and this is the truth. And what we do know about heart attacks, most heart attacks happen when? During the holidays, stressful time of the year, and also during Mondays more than they do any other day of the week. So why is that? Stress related. So those are the things we need to lean into and understand. And then we also have to start talking about optimizing your cholesterol levels naturally. Let's not look at medications. And we know one of the ways to do it is actually eating healthier fats. Yeah, actually eating fats, eating salt is good for your body. Eat healthy fats, preferably raw things like coconut oil, organically grass-fed meats, raw nuts, eggs, avocados, dairy products, whole dairy products, not skim milk, please. Seeds and also olive oil and stuff is also very good and nourishing for your heart. These things make you healthy. This is looking at overall health improvements. That's what it's going to take stress off your heart, and that's where you're going to have less heart attacks and less heart damage. So here's another one about coconut oil. This is just one study that shows the amazing benefits of coconut oil. Show the people who use coconut had a decreased risk of waist circumference, lost weight, decreased their bad cholesterol, and also balanced out their thyroid. Isn't that awesome that you get a multiple factors when you are looking to improve your health and give you what your body really absolutely needs? You're going to see multiple effects of improvement in your body, not just a singular one blood work that's going to change, and it's going to be improving across the board. It's not going to be a trade-off. What's going to make this better but make this worse? That's not how health works. It should improve everything if you're feeding the body the right things. So next section is stuff we want to talk about blood work. We want to really understand what controls your cholesterol levels. We're going to talk about other blood work that actually is probably more beneficial than cholesterol, and we're going to dive into that in just a minute.